What does informed consent for ketamine look like? My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications and how I would go through an informed consent process with a patient. And I have gotten the request for this one several times. So today we're going to go through ketamine, or S-ketamine is what we usually use in psychiatry. Now, I wouldn't say that this is a extremely commonly prescribed medication, but it certainly is one that's up and coming and that has a lot of popularity right now. Now, I say all this with the caveat that I personally do not prescribe S-ketamine, but I may refer a patient for that treatment somewhere else. So take everything I say with that grain of salt. So S-ketamine is FDA approved for treatment refractory depression, as well as depression with imminent risk of suicidality. So one of the benefits of S-ketamine is that in contrast with a lot of the antidepressants, which can take weeks to take effect, the effect of S-ketamine is pretty immediate. And that's because of its mechanism of action. So the S-ketamine acts as an NMDA receptor antagonist. And so NMDA is one of our more excitatory neurotransmitters, and it can potentially be neurotoxic in some situations. So by blocking the NMDA activity, you essentially get an immediate effect. Whereas with serotonin and norepinephrine, it's a more slow process of your body adapting to the blockage of those receptors. So in addition to depression, it does have other indications. It was originally designed as an anesthetic, and it's used for induction of general anesthesia for surgical procedures, as well as for pain management. So this medication has a whole host of potential side effects, which is why it has to be administered in a clinic setting under medical supervision. And you can't just pick something up at the pharmacy and use it at home. People do also abuse this medication on the street. People often call it Special K. And so you have to keep that in mind. That's another reason that it's something that has to be administered in a medical facility. But it is something to keep in mind when someone has either a recent history or ongoing substance use issues, because if they're using a substance that's another stimulant or psychoactive thing like cocaine, that in combination with ketamine could be very dangerous. So this is not a good intervention for people who have ongoing substance use issues. So side effects can include things like anxiety, stomach upset, headache, blurred vision, numbness, sedation. There can be a temporary increase in your heart rate and blood pressure, sometimes vertigo or dizziness, as well as changes in taste, dry mouth, sometimes throat irritation. And for some people, they do get a sense of feeling high or drunk. The things we're really worried about are when there's changes in your vitals. So it is used as an anesthetic, so we need to be careful that it's not causing respiratory depression. Also need to monitor the blood pressure and heart rate, as those may increase. It can cause dissociation. It's a dissociative. That's essentially how it works. And for some people, this can be really unpleasant and very disconcerting. Sometimes people can have bladder issues. And of course, there's also the potential concern of increased suicidal thoughts. Now, I'm sure this list is not exhaustive. If you've done ketamine and you want to share something about your experience in the comments, please do. There's pretty good data to show that there's a significant improvement in depression and SI with those initial doses. However, we don't really have long-term data, and what we have doesn't really show a sustained effect from the ketamine. So people often have to keep going back time after time. And where I see it being a challenge for patients is financially, because a lot of times your insurance will only cover X number of sessions, if at all. And then the person feels like they have to keep going back, and it's not sustainable. But that's not to say that it might be worth considering for someone. If there's another medication that you want to hear an informed consent process for, then please feel free to share in the comments below. Wishing you all good mental health, and I'll see you in the next one.